and I can't trust the children.
It's hard to watch teachers slapped, kicked, and punched by their own students.
That student went to my desk, grabbed a sharp pair of scissors, and threw them at my face.
According to a 2024 study, violence against teachers is on the rise. In a survey of thousands of teachers, 80% said they experienced verbal threats from students, and more than half reported physical violence.
We get threatened all the time. It's not, okay.
I hope you get hit by a car on the way home. I've had kindergartners tell me that.
While reports of violence have increased, experts say the issue isn't a new one. In 2010, the lead author of the study found 42% of teachers experienced physical violence from a student.
It's been a problem for a fair amount of time over the past 15 years.
Experts say remote teaching during the pandemic led to a drop, but when in-person learning resumed, both physical and verbal violence against teachers spiked.
We're telling you there's an issue here. Please don't let this continue falling on deaf ears.
A school district in Oregon was no stranger to this kind of violence.
Salem-Keizer Public Schools is the second largest school district in the state. Our investigation found between 2019 and 2023, there were more than 1,000 reports of staff injuries.
In the search for solutions, Salem-Keizer teamed up with a child mental health facility to bring behavioral health services and daily studies into one location.
Reporter Adrian Thomas shows us how the partnership is designed to keep teachers and students safe.
In a repurposed elementary school building in North Salem sits the Meadowlark Day program, a behavioral health facility operated by a team of therapists from Trillium Family Services and Salem-Keizer staff. Chi Blatt oversees programs like Meadowlark across the state, which provide professional mental health services for students along with their studies.
So we're checking in to see how each person is doing, how each staff member is doing, and setting goals to kind of have forward movement in their day. From there, they're transitioning into their classroom setting. So once school is getting started, they'll be able to go into their classroom structures that will look fairly similar to what it will in a classroom as they return home into the mainstream school system.
Blatt says students typically spend 2 to 3 months in these kinds of settings with the goal of being able to return to their original school. Students can be evaluated to enter the program after being referred to Trillium by a school counselor. It offers a safe space for students with the greatest mental health needs.
What is it about this approach that you believe is successful and effective?
The model that our team holds clinically is that we are going to have the classroom setting where the teachers really kind of focused on progressing the educational component of what we do here with the overlaying process of the mental health interventions.
From Salem-Keizer's side, Director of Mental Health and Social Emotional Learning, Chris Moore, is also helping oversee the program. We spoke to him in our continuing coverage of student-caused teacher injuries in the district. At the time, Moore told us that they employ a team of behavior intervention trainers who train staff in de-escalation tactics and who respond when a student physically lashes out toward a teacher. Moore says the district has added a second behavior intervention center where students who harm their classmates or teachers can continue studies in a smaller, more supervised setting, but without the clinical element like the Meadowlark program.
With those 3 entities that exist now, with the opening of this place, will it meet the need?
We're not even close. We could open up 5 more of these programs today in our area, and there is definitely a level of need. Where we would have trouble to open those 5 programs tomorrow is having an adequate behavioral health workforce.
With the Meadowlark program receiving state funding, Moore hopes this program can set the tone in offering resources to K-12 students with the most severe mental health needs.
What we've really seen too is just the level of support in the community for this project, inspiring others to look at our system a little bit more critically and how our behavioral health care continuum of care doesn't work for most families.
While still a concern, Moore feels the actions the district has taken to provide resources for the most troubled students will have an impact, and that he's committed to addressing the concerns of Salem-Keizer teachers.
And we're going to come alongside folks and listen, but also act and make sure that we're following through with what we say we're going to do. If we're talking about staff injuries, that we have actionable steps that we're taking so that those 1,300 plus staff injuries that were part of our record last year, that we see those drop.
According to the contract between Salem-Keizer and Trillium, the program's goal in its first few years is to serve about 100 students per school year. Reporting in Portland, Oregon, I'm Adrian Thomas.
The effort to bring health care to students doesn't end with mental wellness.
Some schools bring physical health resources to their students. About 60 miles southeast of Cleveland at Warren City Schools, you'll find nurse practitioners who provide services including physical screenings and vaccine updates. The district says it contracted these services from Akron Children's Hospital for families who lack access to a primary care physician. The program is free for students.